Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and definitely I think this is quite convenient for the continuous study. In the last class, we are discussing about the basics of growth and development. So today we will continue the same. And in the last class, we have completed up to chest circumference. And today we will continue with the rest of the part. We will start with the arm span. So measurement of the arm span is also one of the very important criteria in the assessment of the growth. What do you mean by arm span? Arm span is nothing but the distance between tip of the middle finger of the right hand to tip of the middle finger in the left hand when it is overstretched. Okay, both the hands should be overstretched. Then the distance between the tip of the middle finger of the right hand to the distance between the middle finger of the left hand should be measured. Below 10 years, so this will be 1 to 2 centimeter less than the height. Total height, when first you have to take the total height. Compared to the total height, this particular arm span will be 1 to 2 centimeter less. After 10 years, the arm span is equal to your total length, that is height. Okay, so after 10 years, the height equals to arm span. Now, this is very important. Suppose the arm span is less, height is more. Okay, if the arm span is more, height is less, then they are all pathological conditions. Okay, even after 10 years, if the arm span is more than the height, that means it may be a case of Marfan syndrome. Okay, even some of the achondroplasia like condition, arm span and the total height may vary. So this is one of the important criteria of measurements of the growth, that is arm span. Another important thing is upper segment ratio and lower segment ratio. What do you mean by upper segment? Upper segment upper segment and lower segment ratio at birth is 1.8:1 at birth. Okay, so first you should know what is the meaning of upper segment. Upper segment starting from the scalp, that is the occiput, or you can say that scalp area to the pubic symphysis. Okay, upper segment, lower segment ratio you should measure. The upper segment means starting from the scalp to the pubic symphysis, and lower segment means starting from the pubic symphysis to the foot. Okay, so now upper segment and lower segment ratio at birth is 1.8:1, whereas at 3 to 4 years it is 1.3:1. By 10 to 12 years it will be 1:1, that is equal, and after 18 years it will be 0.9:1. That means lower segment ratio will be more than the upper segment ratio. Upper segment, lower segment ratio should be measured from the crown to the pubic symphysis. So what is upper segment? Starting from the crown, scalp I am telling, that is starting from the crown to pubic symphysis, that is upper segment ratio. From the pubic symphysis to the foot, that is called as lower segment ratio. Okay, ratio is completely disturbed in skeletal problems. When the child is having so many skeletal problems, achondroplasia, okay, or skeletal dysplasias. So in this condition, this upper segment lower segment ratio is completely disturbed. So any condition with a short stature, always we have to go for upper segment and lower segment ratio, because short stature may be proportionate and short stature may be disproportionate. Whether the short stature is disproportionate, how you will identify? That is by means of upper segment lower segment ratio. Usually this can be seen in achondroplasia, skeletal dysplasias and so many other conditions. Another important thing is stem stature index. It is also called as a crown rump length, that is sitting length. Okay, so sitting length, so this will be 70 centimeters at birth and 66 centimeters at 6 months, 64 centimeters at 1 year, 61 centimeter at 2 years, 58 centimeter at 3 years, 55 centimeter at 5 years, and 52 centimeter at puberty, and 54 centimeter by more after 20 years. So this is the measurement of the stem stature index. One more important thing that we have to consider in the growth and development is fontanelles. Okay, fontanelles. Usually at the time of the birth, the fontanelles are present, and totally there are 6 fontanelles at the time of the birth. Posterior fontanelle 1, anterior fontanelle 1. So become 2. Now there are anterior lateral and posterior lateral fontanelles 2 each. Anterior lateral is 2 and posterior lateral is 2. So 2 plus 2, that becomes 4. Posterior 1 5, anterior 1 6. So totally you will have 6 fontanelles will be there. Anterior fontanelle as shown in the figure is very important for us, and posterior fontanelle usually it will be open slightly at the time of the birth, but within few weeks it will be get closed. If the posterior fontanelle is not closed or delayed closure will be there even after 1 week, then maybe suggest you have a hypothyroidism. Then talking about the anterior lateral and posterior lateral, these 2 each fontanelles which are present at the sides as shown in the figure, they usually close within few days to few weeks after birth. But the only one which remains for a longer time is anterior fontanelle. Anterior fontanelle start closing from 9 to 12 months onwards, and its closure will be completed by 18 months. Okay, closure of the anterior fontanelle. So this is one of the weakest area of the skull. We should take care of it. Next one is talking about the bone age. One more measurement of the growth is by means of bone age. Very important when you are talking about short stature. Bone age and the chronological age we will consider. Now, this is calculated by the maturation and ossification of the epiphyses. Okay, in the bones we will have epiphyseal ends, which is considered as a growing end, and by considering the ossification centers which are present in the epiphyseal area, we will going to calculate the bone age. A full-term neonate will have 5 radiologically demonstrable ossification centers. What are they? One is distal end of the femur, another one is proximal end of the tibia, another one is talus, calcaneus, cuboid, and the last one is wrist. In the wrist, there are so many ossification center is present. Number of ossification center is equal to age in years plus 1. In the wrist, how many ossification centers are present? For example, if the baby is 2-year-old, age in year plus 1, 2 plus 1, that is equal to 3. There will be 3 ossification centers. So bone age is also one of the criteria for the assessment of the growth. Coming to the next, heart rate. Heart rate at the time is almost all double to that of the adults. Heart rate will be around 140 to 150, exactly double to that of the adults. Even the respiratory rate is also about 40, exactly double to that of the adults. But the BP, blood pressure, will be exactly half to that of the adults. In the adults, 120 by 80. In the newborn, the blood pressure will be somewhere around 60 by 40. Now talking about the heart rate, in the newborn, the heart rate is 140 per minute. By 1 year, it will come to 110. By 2 years, it will come to 100 per minute. By 3 years, it will come to, again, somewhere around 100 and somewhere less than that. By 8 years, usually it will be 90 per minute, and usually by 10 years or after 10 years, it will come to the adult standard of 80 per minute. 72 to 80 will be attained after 10 years. Similarly, talking about the respiratory rate, this is also double to that of the adults at the time of the birth. At the time of the birth, the respiratory rate is almost all 40 to 50 per minute. Okay, so below 2 months, usually heart rate will be, respiratory rate will be maintained around 60 or more, and 2 to 12 months it will be become 50, and by 12 months to 5 years it becomes 40 or more. Now, respiratory rate is 40 at the time of the birth, 30 at 1 year, and 20 at 5 years, and 18 at 10 years. This is the down which is given in the below. That's a rough calculation. Now, below 2 months, if the respiratory rate is more than 60, then it is considered as pneumonia. Okay, so very important criteria. If respiratory rate is more than 50, in between 2 to 12 months, that is considered as pneumonia. Okay. Similarly, if in between 12 to 5 years, if the respiratory rate is more than 40, it is considered as one of the symptom of or presentation of a pneumonia. We should consider that yes, child is having some breathlessness. Okay, difficulty in breathing is there. In the community level, this particular calculation is very, very important. So that there may not be any need of fever and other symptoms. Suppose if the respiratory rate is above than this particular criteria, then it should be clinically considered as pneumonia, and we should start the treatment. Talking about the blood pressure, newborn, the blood pressure is somewhere around 65 to 45 mm per Hg, exactly half to that of the adults. By 8 years, it will be 95 by 65. By 1 year it will be by 75 by 50, and by 10 years it will be 70 by 100 by 70 mm of Hg. By 3 years it will be 90 by 60. So little the order is something irregular. Newborn is having 65 to 45 mm of Hg, and by 1 year it becomes 75 to 50. By 3 years it will be 90 by 60, and by 8 years it will be 95 by 65, and by 10 years it will be 100 by 70. So almost all after 10 or 12 years the blood pressure almost all reaches the normal adult level, just like the heart rate. More than 2 years, if you want to calculate the systolic pressure, there is a formula: 90 plus 2 into age in years, that is the upper limit, and 70 plus 2 into age in years, that is the lower limit. This formula can be also used. Now talking about assessment of the tissue growth. Triceps thickness, biceps thickness and subscapular thickness, these are the three important tissue growth assessment which is done to assess the growth, especially very important in protein energy malnutrition, marasmus, etc. and malnutrition disorder. Triceps thickness, how to do that? Yes, skin fold is picked up over the posterior surface of the triceps muscles and 1 centimeter above the mark on a vertical line passing upwards between the bony point selected for taking the measurement. Maintain a pressure of 10 grams mm square on a caliper, and that means tissue growth should be assessed by using a caliper, okay, on a caliper, and freeing the skin fold from the underlying muscle with the left hand between the thumb, index and middle finger, and holding the caliper with the other hand. So reading is recorded to the nearest of 0.1 mm as shown in the picture. So this will going to help in the assessment of the growth, especially for the muscle thickness. Similarly, subscapular skin fold thickness, the subject stands in the case of triceps just like the triceps skin fold thickness. Inferior angle of the scapula is located first, as shown in the schematic presentation. Skin just below the inferior angle is now pinched up, and reading is recorded in a caliper nearest to 0.1 mm. Lastly, biceps skin fold thickness. Biceps skin fold thickness, child is made to stand erect, facing the observer with the arm on the one side of the body and the palm facing upward. The skin fold is picked up over the belly of the biceps, 1 centimeter above the line marked for upper arm circumference, and triceps skin fold on a vertical line joining the antecubital fossa to the head of the humerus. Caliper is applied at the marked level and reading is recorded. Lastly, we will dealing with the dental age. Assessment by the dental age. At birth there is no teeth. Also the mandibular and maxillary areolar process are not well developed at the time of the birth. Sometimes there may be natal teeth, what is called a sadanta janma in Ayurveda. Then we will have the temporary teeth and as well as the permanent teeth, and there is a detail. These are the details how they are appearing. So with this we concluded the parameters of growth assessment. Thank you very much. In the next class onwards, we shall see some of the important aspects related to Ayurveda and also the important aspects related to development of the child. Thank you very much.